Well, here's the really good news for parents and for kids. ADD is very treatable, and early intervention is the key.
People say ADHD is a fabricated diagnosis. It's really bad parenting. That's not true.
The children, when they get medicated, have all of these other benefits. They have a better time socially. They do better academically. Their self-esteem improves.
It seems like more and more kids are diagnosed with ADHD these days. What exactly is it, and how do I know if my son's got it?
ADHD stands for Attention Deficit Hyperactivity Disorder, and it is a problem that is usually diagnosed when someone is a child.
ADHD is a neurological condition, meaning that it affects the regulation of electrical activity throughout the central nervous system. It primarily affects the cortex, which is the left frontal lobe, and about 95% of the academic instruction and learning takes place in the cortex. So you can see that the implications for impairment in educational settings is rather extreme.
It's characterized really by three things. One is a difficulty paying attention at an age-appropriate level. The second symptom is impulsivity. These kids will often blurt things out. They'll interrupt the teacher. They'll interrupt their parents. And the third symptom, which is probably the most famous, is the hyperactivity. The kids act like they're driven by a motor. They don't seem to ever stop. They may have difficulty sleeping. They're running all over the place, driving the mothers crazy.
Kids with ADHD often have difficulty getting the information from the frontal lobe, from the cortex, through the arm onto the paper. It sets up achievement problems. They start to fall behind, which sets up social adjustment problems. They start feeling poor about themselves.
But when it comes to things like video games or one-on-one interactions, these kids actually can pay attention. So if it's something that is extremely interesting to them, or if there's just one person in the room with them, they're going to have an easier time focusing. And this can make it hard to understand, does your child have ADHD? Because you'll see sometimes they can pay attention and they can be super focused. And then other times you'll hear, especially from teachers or from others when your child is in a big group, that your child's distracted and not focused.
People say ADHD is a fabricated diagnosis. It's really bad parenting. That's not true. People say medication treatment is dangerous and it's hurting all these kids. That's not true. It's one of the safest treatments that we have, but it's limited. It's not a cure. The effect of the prejudices against ADHD diagnosis and medication treatment in particular are that a lot of families get hurt because the kids do not get diagnosed, they do not get treated properly, and the condition goes on and on and on and on.
Here's the really good news for parents and for kids. ADD is very treatable, and early intervention is the key.
Medication is also critical in dealing with ADHD. A lot of parents are worried about using medication, understandably, since it's gotten quite a bad rap. But medication is no cure. Medication only works for the time that it's in the child's body and helping their brain function in their daily life.
Children, when they get medicated, have all of these other benefits. They have a better time socially. They do better academically. Their self-esteem improves. There are less family conflicts. So there are all these benefits when the symptoms improve, and medication is usually the fastest way to get that improvement, and sometimes is the only way to get that improvement.
We do know for sure that if ADHD is not treated, things will get worse as life continues. If ADHD is a problem, it's very important to recognize it and treat it appropriately now for the sake of everybody, and that includes society in general.
Have a question? Ask the experts at parentsask.com. Because raising kids raises questions.